I'm here to talk today about something that I thought was appropriate to come to the football field to tell you about. Documentation. Documentation is a really important part of speech pathology and probably underappreciated. First of all, there's a saying in speech pathology: if you didn't document it, you didn't do it. And if I was an insurance company paying for the therapy that you're providing and you didn't do something, I'm not going to pay for it. Another reason for documentation, and an important purpose of documentation, is that it is a legal document and justification for what you've done. For example, if you were evaluating the child who had an articulation problem or working with a child with a language problem, and they wound up having a hearing loss that you didn't test for, in all likelihood you could be sued for malpractice. So it's important somewhere in your documentation to record what you've done. For example, on the contact sheet, on the end of semester progress reports, or especially in the evaluation reports and progress notes, to form a legal document which indicates what you've done. So that would be the place on the evaluation to indicate what you've done to check that a child did or did not have a hearing loss. Day to day, amongst the most important things you'll do, and perhaps the most altruistic purposes of documentation, is for you to be able to tell where your client is. And so that's kind of why I brought you to the football field today, to talk about that. Knowing where your client is, their success rate, their performance level, is going to help you and guide you in demonstrating their progress. So whether you're here, or here, or here, or here, that will tell you where to take your client and what to do next. I'm here at the 20-yard line, and you can see how far the goal is away from me right now. If your client is only succeeding or performing at a 20% level, it's way too hard. Imagine if you were taking a class and you were scoring 20% on the exam. You'd have to know that it was either something with you or with the class that had to change. And the same is true for your client. Think of how discouraged the client is going to be only getting 25% correct. So something has to change. Hold on just a second. Now I'm at the 50-yard line. This means your client is only getting his targets correct 50% of the time. That's discouraging too. Imagine getting 50s on all your tests. Are you going to be motivated to do better and to study? Hopefully. But maybe what we're asking you to do is too hard. And at that point in time, what we're looking for you to do as the clinician is to take it down a couple notches, to break it down into smaller steps so the client can succeed even more. All right, now I'm between what would be the 70 and 90-yard line. I can see the goal. I can almost touch it. At this point, this is a good area for you to be working in. As a matter of fact, we call it the work zone, the area where the client hasn't mastered the information yet, but is getting it enough of the time that they feel really, really close. This is where you should be with most of your activities. What you'll find in day-to-day practice is that clients have different performance levels in different activities. For example, in stuttering, clients are asked to speak while they're reading aloud, while they're in conversation, and while they're on the phone. And we see that they usually have the highest percentage level of performance in reading, and the next highest in conversation, and have the most difficult time on the telephone. Each of your lesson plans for each of your sessions usually has your client going through a number of different treatment modes. And as a result, you'll see that their performance level should vary. It's up to you to measure the performance level and adjust the client's activities to match their needs. Here we are, 5 more yards to go. The end zone, you can touch it, you can feel it, you can want it. And at this point, the client has almost mastered the information. And so you have to ask yourself, or I want you to ask yourself, when do we reach the point where we can change and go to another activity? When does the client master? Does it have to be in the End zone, does their performance have to be at 100% for us to consider the client to have mastered that technique? And the question is a bigger one. For example, did you get 100 on all of your exams to be able to pass a course? Or was 90 okay, or 80? What that means is that at that performance level, we can expect and hopefully anticipate that the patient can grow by themselves. We've brought them the full length of the field right down to the end zone, and we're going to let them take it in themselves. So you don't have to get 100% performance level to end or consider the client's task to be mastered. So I hope I've shown you the importance of documentation. I don't know of anyone who's gone into speech pathology because they like the documentation. However, I do know speech pathologists who weren't good at documentation and lost their jobs as a result of that. I don't want that to be you. So my advice to you is to become good at it. Put it in its place. If you're not good, if you're struggling at doing the documentation, it can overshadow the satisfaction of joy of doing your therapy. So buckle down now, really learn the basics, get some practice with clients, and get documentation to work for you instead of being its slave.